Well, welcome back, everyone. Shaquille O'Neal is back home and walking after having hip replacement surgery a little more than a week ago. His latest video shows him walking around his home gym with the help of a crutch. Shaq's had nothing but jokes since posting pictures of himself in a hospital bed confirming the surgery, but he did get serious for a second to talk about just how painful it was. Now that was an interesting shot right there, huh? Oh my. Well, this morning we're getting candid about hip replacements.
Dr. David Doherty, UT Health orthopedic surgeon with Memorial Hermann, is here with everything you need to know about the procedure. Good morning and thank you for joining us.
Good morning. Thank you for having me.
Why do people need hip replacement surgery?
So hip replacement surgery is a procedure that's performed in people with intractable hip pain. They usually have a degenerative cause that is slow moving. It takes years to develop, but ultimately they get to a point where they have trouble bearing weight, they have trouble taking care of the activities of daily life, and essentially they have a lot of pain that prevents them from enjoying life. And so hip replacement is an excellent solution for that scenario.
Now sometimes you can do a partial hip replacement versus a total. What is the difference?
So partial hip replacements are usually reserved for very low demand patients. In my hands, I think that a total hip replacement, or replacing all of the parts, is a much more effective procedure. It's more reliable and can lead to more longevity of that hip replacement.
Okay, we're talking about an athlete who is in excess of 7 feet tall.
Right.
You don't have parts that you can just pull off the shelf and hand to him.
So we're blessed in this field that there are some amazing companies out there that make amazing implants that are, for the vast majority of the population, they're going to work, they're going to fit. They have a variety of sizes that we can accommodate most anatomy. For somebody like Shaquille O'Neal, who's 7 feet tall, maybe 350 pounds, you might be looking at a custom implant. So for every patient, we template, we get advanced imaging, maybe even a CT scan to learn as much as we can about the anatomy. And for somebody like that, we might be using a software program to potentially 3D print an implant or make something that's custom for him that's going to fit this unique circumstance.
How intriguing. There is something for everybody in this department. When I think about what people are going through, you mentioned the pain. You can only imagine. I mean, this is something that every step you take, I'm sure that you know something needs to be done. How do you know? What are those symptoms that it is really time to get a replacement, that this is beyond any type of rehab?
So some of the earliest symptoms you start feeling is potentially a pain in the groin. It can be vague. Some people think they've pulled a muscle, a hip flexor muscle, but groin pain is a telltale sign of a degenerative process in the hip. You might develop some stiffness as well, but ultimately if it gets to the point where you're thinking about this a lot, come see me. Come to my office, we'll take some x-rays, we'll do a good physical exam, we'll learn about you and figure out a good treatment plan for you. Maybe it's not surgery for everybody, but if you are in a situation where you have bone-on-bone arthritis and you're not making progress with these other conservative measures, then hip replacement is probably a good idea for you.
Following the surgery, what about the recovery? Are we talking about long-term? Shaq apparently was walking a day or two after he had the surgery.
So, you know, I've heard your intro and everything. You keep calling it a painful surgery. In my experience, the surgery and the post-op experience, the pain almost goes away very quickly. The groin pain, it's an overnight phenomenon. You get excellent range of motion, pain-free movement. Sure, it is a surgical incision, and that takes a little bit of time to heal. But as you see with Shaquille O'Neal's process, he's a week out from surgery, starting to get back into the gym, starting to work out. By a few weeks out from surgery, you should be doing a lot of things out in the gym, walking a lot. By a couple months out from surgery, could be back to normal, doing everything and anything you want to do.
How intriguing and helpful info. Anytime there's a high-profile case like this, it's interesting to learn more about it because it helps everybody right here in Houston.
Absolutely.
All right. Thanks for your time from Memorial Hermann.
Thank you very much.
Good to see you.
I appreciate it.
All right. We're at